Hello, welcome to Introduction to Hipaa for Medical Professionals. Today we're going to talk about all things Hipaa. So what we'll learn today is, what is Hipaa? Why do I need to know this? How does Hipaa affect you and your job? We're going to understand the risk and how to reduce those risks. And who does Hipaa apply to? So what is Hipaa? Hipaa stands for Health, Insurance, Portability, and Accountability Act. Now this is one of the many things in healthcare that gets confused. Most people say Health Information Portability and Accountability Act. It is not that. I mean, it does include health information, but it stands for Health Insurance Portability and Accountability Act. And it's the primary federal law that protects the privacy and the security of our health information. It also gives patients rights to their health information. So what is Hipaa compliance? What does it mean to be compliant with Hipaa? And it pretty much is important for healthcare organizations to avoid legal and financial penalties. Its adherence to the physical, administrative, and technical safeguards outlined in Hipaa, which covered entities and business associates must uphold to protect the integrity of protected health information, otherwise abbreviated as PHI. So here's a few Hipaa facts that maybe you didn't know. And there are some of them that I didn't know either. So the first one in 7 healthcare organizations still do not have an appointed Hipaa compliance officer. Can you believe that? Most of them do not have an appointed Hipaa compliance officer. Most of the times that's the supervisor or manager, but not a specific Hipaa compliance officer. The next one, 50% of healthcare organizations believe they would fail a Hipaa audit. Did you know that? 50% out of all the people and companies or organizations that were surveyed, 50% of them believe that they would definitely fail Hipaa audit. Unauthorized access to records accounts for 20% of Hipaa breaches. And we're going to go a little bit further into that, because I think that should have been the number one. Unauthorized access to records accounts for 20% of Hipaa breaches. Nearly 200 million patient records compromised since introduction of Hipaa. Wow. Nearly 200 million patient records have been compromised since the introduction of Hipaa. So again, what is Hipaa? Hipaa, which was passed by Congress in 1966, Hipaa has multiple purposes. It gives patients some sort of control, like control to their or access to their rights, to their records. Reduces healthcare fraud. Hipaa mandates industry standards and regulate insurance policies. So Hipaa does not just apply to healthcare organizations such as doctor's office or clinics, hospitals, home health companies. It also applies to the insurance companies as well. Does Hipaa laws apply to you? Yes, it does. Hipaa requires that all members of its workforce be trained in Hipaa compliance. So any person or individual employee that you have under your workforce has to be in compliance with Hipaa. They have to have some sort of Hipaa knowledge and Hipaa training. So let's talk about the 5 Hipaa rules. There's the privacy rule, the security rule, the breach notification rule, omnibus rule, and the enforcement rule. The privacy rule sets limits regarding the use of patient information when no prior authorization has been given by the patient. The security rule sets standards to protect the protected health information. All covered entities and third-party business associates that perform a service for or on behalf of a covered entity must comply with the security measures. So anybody that is involved, this rule sets the standards for you to protect the health information of that patient. The next rule is the breach notification. The breach notification rule is the Department of Health and Human Services must be notified if a data breach has been discovered. This must be done within 60 days of the breach if it was discovered. It's basically saying that if you have discovered a breach, you must report it no later than 60 days or you have violated that rule. The omnibus rule pretty much explains that you cannot use patient information for marketing or fundraising purposes without their authorization. That will definitely get you some tier penalty violation for HIPAA. The last one, which is the enforcement rule, states that should a violation of HIPAA occur, this rule lays out how many resulted investigations are carried out. So we do not want to break any type of HIPAA rules. We don't want to have any type of HIPAA violations because that's why these rules are in place. So understanding clients' rights. So what are some examples of that? What are some examples of rights? What are we protecting? What's considered HIPAA? What's considered a HIPAA violation, or what's considered PHI, protected health information? This includes the patient's name, address, the reason that they are sick, blood tests, diagnosis, anything that would give in some sort of investigation of why the patient is there or why you're caring for the patient. So let's do a little quiz here. Let's see if you have been paying attention. HIPAA's goal is to catch staff sharing patients' health information with those who do not need the information. Is this true or false? HIPAA's goal is to catch staff sharing patients' information with those who do not need the information. Is this true or false? This is false. This is not what HIPAA is about. The goal of HIPAA is, again, to protect the confidentiality of that patient information from improper use or disclosure. So if you see an apparent violation, you should report it to your instructor, to your immediate supervisor, someone who can immediately assist you in contacting the privacy officer. Why is protecting privacy and security important? Well, to build those trusted relationships with your patients and with your employer, for HIPAA benefits, to continue to protect their privacy and to reduce the risk of violations. When should you look at information? Can you just open a patient's chart? Can you just dig through a patient's information file? No, you can't do that. Even though one of the great benefits that we have as working in the healthcare or medical field is that you have access to a lot of stuff. But do you really? And I'll explain what I mean by that. I mean that just because you have access or you think you have access to something doesn't mean that you should have access to it. You can't just open a patient's file. If you know your loved one is with this company or your loved one goes to this office, you cannot just go look in their file just because I want to see. Access to those patient files and the data should be strictly for professional reasons and necessary to perform a role or duty. Being curious or related to a patient does not justify access to their data. So let's check your knowledge. Dr. Williams asked Sue, a nurse, to bring up his patient's lab results on the computer screen. Dr. Williams looks around and does not see any other staff or visitors in the area. He asks Sue to turn the monitor so he can see the chart. There is no other person around the desk when the screen is turned towards him. When Dr. Williams is finished, Sue turns the screen back around facing away from the public area. Now, did Dr. Williams and Sue violate the patient's privacy by turning the screen and viewing the lab results? No, they did not. There was no one else in there. No one else was able to view it. So they did not violate Hipaa. So let's talk about the patient's rights. So the patient has a right to receive a copy of your facility's notice of privacy practices. The patient has a right to request an amendment to their protected health information. They have a right to receive any disclosures, and they do have a right to complain if they feel their privacy rights have been violated. So anytime you encounter a patient and the patient has a complaint, don't take it personal. They do have a right to complain about an issue or something that they're feeling. We want to make sure that we're always making them understand or letting them know that their feelings are valid. And that's just another way of building a trusting relationship. Even though it may be, you may think it's a personal attack, you don't know what that patient is going through. So they do have a right to complain how they feel and if they think that they have been violated. HIPAA violation examples: divulging patient information, texting private information with your friends. Now, this is something that happens more often than normal. We have to remember, we have so much at our fingertips. Now, phones are everything. And I can attest to that. If I leave my phone, I feel like I'm lost. I know that it's not a good thing because these phones are like computers. They have everything. So we do have a lot of stuff at our fingertips, and it's so easy. Now, technology has changed, and I hope that everyone is up to date with that technology, but we know that there are still some offices and some physicians that just prefer those same old charts with the rubber bands around them that's falling apart. But that's their right and that's their preference. But we have so much at our fingertips, and now there are cloud-based apps that companies use now to where you can safely transport or transmit patient information through your phone or through some kind of electronic device. There's a hospital that I do rotations at, and everything for them is pretty much done on a phone. So, but we just have to be careful that we're not operating outside of those walls by texting those patient information like to your friends. Discussing information over the phone, you have to be very careful about that. You don't know who's listening. And posting on social media. This happens a lot also. And there was actually just I think an RN that lost her job, and I think may have lost her license or maybe a penalty for a couple of years by posting private information about a patient online. I don't know why you would think to do that, but it happens. So let's check your knowledge again. Jennifer, a nurse, and Tom, a physical therapist, are eating lunch together in the cafeteria. They begin discussing a patient that they are both treating. The cafeteria is crowded, and others around them can hear them referring to the patient's name and other confidential information. So the question, are they violating the patient's privacy in this situation? The answer is yes. If you answered yes, then you are correct. They are violating the patient's information. You cannot openly disclose any type of information like that, especially when you're around a crowd of people or out in the opening. That is a big no-no. Keeping things confidential. Be careful with computerized information. Be mindful of your surroundings. Agencies and their employees can receive up to a $250,000 fine for violating HIPAA and or up to 10 years in prison for using protected health information for personal gain or malicious harm. And you can lose your job for that. It's happened and it's still happening. So please be mindful of that situation. You don't want to have a fine, because if the agency gets a fine on the account of you, I'm sure that you will also get a fine or lose your job. And you definitely don't want prison time. By complying with HIPAA regulations, not only are you protecting your patient, but you're also protecting your company and yourself. This concludes our HIPAA training. I do want to just go over a few things. So HIPAA is very, very important. Very important that you stay in compliance with HIPAA. You have to be very mindful when you are out and about and you see a patient and a patient wants to talk or discuss with you. That may be fine. That may be fine, but you have to remember that is such a sticky situation, because number one, the patient is bringing it up, not you. So if the patient wants to talk about something, then you have to make sure you let that patient know, okay, remember we're out in the opening, I don't want to discuss that. And if they continue and they prefer to discuss that, my suggestion would be to go where find an area that's more private and make sure you let that patient know that this is not the place to discuss that. Now, if the patient has questions, I'm not telling you to turn the patient away or to ignore them, because you never want to make a patient feel like they are being ignored, whether you're on the clock or off the clock. I know a lot of times the home health nurses and aides are approached all the time by the patient themselves or family members. So you want to make sure that you will always be protected. My doctor always tell me, when you're doing stuff, always think about the end game or the end result. Always think about the end result, which will be court. So just imagine whatever situation that you are in, just imagine if you had to go to court, will I be covered? Every time you encounter a patient or a family member, because patients don't always want their family members in their business as well. So if you're caring for a patient, sometimes they don't want their daughters or their sons in their business, and that's their right. So you have to be mindful and think about, will I be covered if I go to court? Have I crossed all the I's? Have I dotted all the T's? Will I be covered? You cannot openly discuss their information. You cannot discuss their information with people unauthorized. You can't discuss the information unauthorized. So make sure that you are staying in compliance with Hipaa, with your company rules. Make sure you're protecting your patient's information, and make sure that you COB, cover your behind. Okay? So if you don't have any questions, thank you so much, and you have a great rest of your week.